Hello, my viewers. Your wonderful person, Eziada is here again. I just want to bring you greetings from my side of the globe where I reside. I want to say good morning, good afternoon, good evening, and good night. All depends on where you are around the globe and the time you are in now. Thank you so much. Yeah, before I go forward, I just want to tell you that today we're gonna discuss something that we're gonna take in series. It's gonna be coming in series, in parts. The series, of the situation we're gonna discuss today gonna be in series. So we're gonna start from part one today, and we take it from there till we finish to wherever we're gonna get it up to. So before I go forward to bring you the topic of today, may I just make a disclaimer, please, as usual. As far as I am aware of myself, I have no charity, please. I have no orphanage as to ask anyone for donation. So please, why am I saying this? In case anyone comes to you or contact you in any way with my name or with the name of my channel, please, which is Holistic Living with Stella Please do not ball. Don't give up. Don't give to ears to such invitation of giving donation by any means, please. It's not from me. It's never from me, please. There are a lot of scammers here and there now in the world we live in. Thank you very much. And I also want to use this opportunity to thank all my viewers that always view and, watch my video, and all my subscribers and all of you that gives me thumbs up, and those of you that comments nicely, and those of you that are sharing as well. Each and every one of you, even those who are just starting today, maybe from this video, please, I just want to thank each and every one of you and appreciate you, and to say without you, I don't think I will be going on to be doing this. But I believe that we will continue to do this and you will be benefiting from what we bring here every time. Thank you so much. Without much ado now, so please, we're going to bring out something that is an awareness again, because I like to bring an awareness in situation health-wise, things people should know as to help them take care of themselves. you know Today we're gonna talk about, as I said, it's gonna be in series. So today we're gonna start from part one of the series, and it's gonna be about our kidney care, prevention of kidney problems. That is part one. Today's one is part one of the series, which is prevention of kidney problems. So we're going to be discussing about, diverse ways of looking after the kidneys, prevention of the problems, taking care of it, conditions that may come up with our kidneys, and how do we handle it, and the best way out, and, as to manage very well and keep living good. Okay, so now, prevention of kidneys. Why am I bringing this? Yes, I have introduced myself as Stella Yes, I have worked as a nurse for over 36 years. And in kidney unit, specifically in dialysis unit, hemodialysis unit, I've worked there for over 22 years. So I have gotten a lot of experience in that area. And for that, I'm just trying to bring my experience to give people an awareness and things to do, because the problem of the kidney is nothing anyone would like to, get himself or herself, suffer it, especially if you have the knowledge of what you can do to prevent yourself from getting into kidney failures So that's why we're starting today to talk about prevention of the, problems of the kidneys. So first and foremost, in order to prevent kidney problems, you need to live healthy. Healthy living is very, very important for you to prevent problems with your kidneys. Very, very important. You need to take proper care of yourself. And we're gonna go ahead and look into what should we do to help us look after our kidneys. Actually, there are so many ways there are so many things we need to know about kidneys. But remember, this is awareness and this is an overview. And in we will be bringing out more things about these kidney problems, prevention of the diseases and the condition of the kidney, stage by stage. So as I said, we're dealing with part 1 today. So as I said, you have to have a healthy living to make sure you prevent kidney problems to yourself. And what are we talking about? For example, number 1, you have to maintain a healthy weight. Don't be overweight. Whatever you can do to make sure you don't put on a lot of extra weight, please do it and help yourself not to carry overweight. And then you have to maintain good blood pressure. Make sure your blood pressure is in order. You know, I have talked about some of these things before, but today we are gonna just, relate it to kidney um, conditions and prevention of kidney problems. Okay, but generally in health, you look after yourself. Make sure your weight is okay. You're not overweight. Your blood pressure is not on the roof. Your blood sugar is on normal level. You maintain all this, and then you exercise regularly. You do regular exercises. If you can't go to gym, go to, or swimming, take some chair aerobic inside your house. Move your coffee table. I always say this every time. Do some exercise. Do some abs roller in your house. Put a little mat and do some abs roller. You have a lot of them you can buy from Amazon or any online you can buy and use them to do some little exercise at home. Go for a walk. Yes, I always do talk about this. Go for a walk. Is all this exercise, and you have to make sure you eat very well. Eat very well. Eat balanced diet. I know I always say it. We know the economy is bad, whole worldwide, but try as much as possible to feed yourself very well. Feed your body with right food, right quantity of food, and right quality of food, including your children. Including your children. Take a lot of vegetables. Very, very important. Less carbohydrate, less sugar, and less fat. Um, less fat, and make sure you always take, fruits, but be mindful about sugary fruits like grapes, the tiny grapes, um, which are so sweet. I'm just using that to give example. There's so many sweet, you know, um, fruits out there. So be mindful how much you take them. Take them in moderation. There's so many of them. There are loads of fruits we can take. But when we come to those ones that are very, very sweet, we have to take them in minimal quantity, because it can spike up blood sugar, and blood sugar will go high, especially if you are at the risk of developing kidney problems. So be careful. And then quit smoking. If you're a smoker, try and quit smoking. If you're struggling for that, there are places in a hospital in the government has set up, especially in developed countries, where you can get help with quitting smoking, stopping smoking. They can help you with. There are people trained there to help those who are struggling to stop smoking. Be able to help you. And then you stop gradually, okay? And then you limit intake of alcohol. Alcohol consumption, it should be limited. Don't make it a regular thing, and that will make you going to become an alcoholic, because you just want to, you know, consume it, that it tastes good or it feels good, it makes you feel high or feel good, whatever. But remember, it is not good for your health. Excess alcohol is not good. Please remember, we're talking about prevention of kidney problems. And then we're gonna take all these things one by one now. First and foremost, we mentioned about the weight, the management of how do you manage these risk factors, which we have named, we listed up there. Okay, the risk factors we have listed: overweight, too much high blood sugar, high blood pressure, heart problem, all those things, you know. So how do we now start to manage them, the risk factors? And one of them, is diabetes. And if we take them together with high blood pressure, high blood pressure and diabetes. So in this instance, it has been realized that these two are the major risk factors of kidney problems, kidney diseases. When you have diabetes, when you have high blood pressure, they trigger off disease condition of the kidney a lot. They do trigger it a lot. A lot of people, from experience, most of the people we have, on dialysis, for example, due to kidney failure, mostly people with very, very high blood pressure, that their high blood pressure is so extreme to the high level, and then the diabetic, uncontrolled diabetes. That's why you need to manage your diabetes very well. If you're diabetic, if by any chance you happen to develop diabetes, you have to make sure you manage it very well. Follow your instruction of your doctors and all the people looking after you. Make sure you do what they ask you to do, so that you don't risk yourself into kidney problem. Therefore, these problems, as we said, this diabetes and this high blood pressure should be managed effectively with medication and diet, including exercise too. Medication, diet, exercise. These are the effective ways, putting these three things into action. They are the effective ways of managing this condition from developing kidney problems. And then we talk about obesity. Obesity, which is the excess weight we talk about, it is a risk factor. We should handle it and, let it not be a factor that will lead us into having kidney problems. And then when you maintain a healthy weight, you can reduce the strain on the kidney. If you maintain a healthy weight, you won't act burden to the kidneys, because the kidney won't struggle to function, because kidney has a lot of job to do to remove all the unwanted elements in the body, the urates and all the likes that the body does not need. It is through the kidney that we get rid of them, through passing urine, mostly. So the kidney has to be functional. It has to work very hard, very well, to be able to take out all the things that the body does not need. So some of the chemicals that the body does not need, the kidney has to work hard to take them out. And you need to help this kidney by reducing all the risk factors, the diabetes, the excessive weight, the hypertension, and then by managing them effectively with medication, diet, and exercise. Again, we talk about the heart disease, heart condition. It's a health of the heart has a link with kidney problem. It can also have a very great impact, yes, on the kidney when you have heart problems, heart disease. Because it's this the heart that will pump out the blood through the kidney and the heart, they work hand in hand. And whatever affects one affects the other. You see? If the heart starts struggling, could not pump blood, the kidney will not have enough blood, will not have enough, blood, yeah, which is the liquid form of the stream through which the all the elements that the body doesn't need leave the body. Okay, so therefore we have to manage it very well. Very, very important. Our hearts, we have to take good care of our heart, so that we don't have heart problem. Okay, because it impacts the kidney as well. Then number 2 is maintain a healthy lifestyle. Maintaining a healthy lifestyle. And we say that diet, number 1, healthy diet. You have to eat very well. Eat properly. Eat balanced diet with plenty of fruit and vegetable, as we have said. But be mindful of the type of fruits you take. Be mindful of, very excessive sweet fruits, so that you don't spike blood sugar, especially if you're already in the high risk, in the risk factor of um, you know kidney problem. So you don't spike your blood sugar to go up very high with sweet fruits. Be careful. Take a lot of vegetables, as much as you can get. Okay, so by the time you're doing this, you'll be able to cut down the possibility of getting kidney disease. All right, and then limit intake of sodium. Intake of sodium, saturated fat, and processed food. With sodium, which is salt, the normal salt, sodium, the normal salt we eat, we used to cook, we used to, add to our food and things. Limit it. Don't put too much salt in your food. And after cooking, try not to add, on the table when you come to eat, you start pouring salt again. A lot of people do it, and that's why so many people are developing on this kidney disease we are talking about now. There is no need risking it, because this sodium, it helps to retain fluid. And when it retains fluid, the body has a lot of fluid, and then the kidney struggle to handle so much fluid that is more than enough for it to handle. It struggles. It's become difficult for the kidney to manage with excessive fluid retaining due to too much salt you are taking. And with this, you see the person will start swelling, the face, the ankle, the feet, everywhere. And that's one of the signs of a kidney infection, kidney disease setting on. If not up to failure, up to this point of being swollen. Have to be careful. Salt, it retains fluid. Yes. And then saturated fats and processed food. Too much cholesterol. Though the heart does not need it. We're saying already, you look after your heart. Now you're stuffing it with cholesterol, which is a bad fat. The body does not need it. The heart does not need it. And it triggers heart attack and all those things. Heart diseases. So you don't want it. It's not good for the heart, all these bad fats. So be careful. Be a person of, when you want to buy some of this processed food, if you must have them, be the type of person that read the label very well. Read the label. When everyone that is labeled very well, especially, the processed food in things, they'll tell you the normal salt level that you should consume, and tell you salt level in that particular food. They'll tell you, so, fat level, protein level, all those things. You need to know by reading those things. Make your time. Don't say you're in a haste. Make your time and read them. By the time you get used to reading them and studying them before you buy, you don't need to be reading every time you go shopping. By now, by next time you go, you must have now known much about the ones you have studied. It's now gone into your brain that you can retain and know this is what it is, Okay? Like myself, I know I cannot take anything more than, for example, 3 milligrams of fat in 100 milligrams. I cannot take anything that is more than 3. Anything not more than that, I keep it back. Yes, it is something you practice and you learn it and you put it into practice for your health. And then consider reducing excess protein intake if you have developed kidney disease already or at risk of it. Too much fat, too much protein, excess. Some people would like to eat meat, lumps of meat, lumps of meat. Some people, it baffles me when I see some people carrying a whole chicken. One person will carry a whole chicken to finish at a go. I'm like, oh my God, how do they do this? And then maybe the next day the person is eating the same, another type of proteinous food and red meats, all these things that are high, very high protein in large quantity. Everything should be taken in moderation. When balance it, don't take excessively, especially if the kidney already has started having some challenges. Okay? And then limit intake of alcohol. We have said this again and again. Reduce intake of alcohol. Alcohol does nobody any good. Excessive. If you cannot stop it, reduce it. Reduce it. Okay? If you want to help yourself, as I said again, each bottle is only that a lot of people don't have time to take a read on the bottle. We tell you how much you should consume in a week or in a day, just form the habit of reading labels. It will help you a lot. And then we go to regular exercise, as we talk about it every time. Very, very important. Remember, what we are talking here is prevention of kidney disease. You don't want it. Endeavor to do up to 30 minutes, at least 30 minutes of moderate to intensity exercise, most days of the week. You try and do some, even if it's 30 minutes. 30 minutes in most days, moderately to intense, as much as your body could carry. Just try. And as soon as you start doing it, you start getting used to it. You'll be surprised any day you didn't do it. You just feel like something is missing in you. And you like to go back and, and do it, and then make out time. Time. Most of the time we will say we don't have time. We don't have time. Yes, we don't have time, but we can make it out. We can carve out time. 30 minutes exercise most days is very, very important. And then again, we talked about this quitting. Oh my God, we talked about this quitting smoking. Smoking does nothing good to the body, especially to the kidney. It damages the vessels, the blood vessels, and can be a big problem for the kidney to function well. When the vessels are damaged, especially it goes to clog it, go to shrink it, and then the vessels through which the blood will be flown for kidney to function, the heart itself will struggle, the kidney will struggle, everything will begin to fail you. all the organs will begin to get affected. It's not good. Smoking affects the blood vessels so badly. Try and quit. Okay? And then remain hydrated. We talk about this every time. Remember, again, don't forget what we're talking about, prevention of kidney problems. And I would like you to go back and, listen and watch my previous videos. You get other tips relating to what we are doing. But this one, we're specifically, deliberating on kidney. Drink plenty of water daily, up to 8 glasses of water or 2 liters of water, so that your kidney will function properly by making use of the water to flush out the unwanted element from the bloodstream that we don't need, that the body doesn't need, that when they pile so much in the body, it causes another problem. It causes what we call uremia, which is too much of urea and all the things that is supposed to go out of the kidney, of the body. They will all be retained in the bloodstream, and that will cause a lot of problems, other condition. Okay, then we talk about managing stress. Manage stress. We all are stressed one thing or the other. In life, whatever you do, you will have, remember, again, I want you to go back again and watch my video on stress, recognizing and managing it. If you go back, is the topic I treated in the past. It says stress, recognizing and managing it. That will help you to understand more about this place. Because as I said, we're just mentioning all the things we should do and the things we should not do to prevent kidney problems. So learn to be, stay away from negative life, negativity, which impacts the kidney. Find the best way to manage stress. Find the best way to manage stress. Go back to that my video. It will give you a whole lot. The whole video was was stress, just stress, how to manage it. You get more information there, because this world we live in is full of stress. And stress, remember, no, there's normal stress. The short-term one is normal, where when you get, like, you have a work to do, you have some children to take care of, you have travel to make, you have a new exam coming up, you have new job starting, you stress up, or you have long day you've done at work, you've stressed out. And then, but for a while after that, you rest, then you'll be able to distress yourself, and then you become normal again. But when stress goes into disease condition and cause you all those disease condition, is when it becomes long-term chronic stress. So go please and watch that my video again. Stress, recognizing and managing it. Okay. And then the third one we're going to talk about in prevention of kidney problems is be mindful of medications. Okay, like over the counter, people go over the counter and they ask to buy medications, especially the over the counter pain relievers like ibuprofen, all those non-steroidal anti inflammatory medications. We have to be careful. We're talking about this ibuprofen. A lot of people take it a lot. Because it's a strong pain reliever. And for that, they keep taking it with that, because they can go over the counter to buy it, or the naproxen, and keep on piling in the body, and the long use of it damages the kidney. So we have to be careful. We have to be very, very careful on buying medication over the counter and keep on taking. And then again, is even the prescription medication. It says you should follow the instruction. Follow the instruction you're given. Take it as your doctor tells you to take, please. And when you're taking this, make sure you are watching yourself. If you have any reaction, any complication, anything, please get your doctor to know. Stop immediately and contact. There's always a line to contact if you have a medication reaction or you have any concern with your regular medications. Okay? Just take as you are directed. All right? If you miss your medication at the time, make sure you don't take double dose. Don't say, oh, I've missed the morning one. Now it's time for me to take afternoon one. For that, I'll take the morning and afternoon one together. No. Forget about the morning one you did not take. Take the afternoon one, please. Because if you take the morning one and the afternoon one together in that afternoon, you are overdosing. Does that make sense? Please. Okay? And then even then, you have to have a regular checkups. It's good to have a regular checkup. See your doctor. Get regular checkups. See your GP. See your private doctor. Go to general hospital or wherever, so that your doctors, they follow you, and then whatever recommendation they gives you, and checkup does not mean you're not well, you're ill now. Nothing is wrong with you, but you want to make sure you're healthy, you're okay, nothing is coming up. You don't want to keep quiet until the whole thing comes up and becomes so severe and becomes so serious that then it was not diagnosed on time. It is always good. I always say it here. Please make sure you go for checkups. Go and check your body. Just like you check Ministry of Health in United Kingdom, you have to check your car every year. You must do it. If it's not done, police will catch you on the road because you didn't do it. It's a yearly check. That's how bodies should be checked. If not, even up to maybe twice a year if you can, or maybe once. That would be okay. Take care of your health. Get tested. Get tested. And what do you mean by get tested? If you know you are at risk of getting kidney problems, like your weight is too much, you have diabetes, or you have high blood pressure, make sure you get yourself tested more often than person who has no problem. Okay? So that you be able to know that everything is in order. Okay? Talk to your doctor about getting tested. They will always direct you on which way to do. Okay? It is good to have knowledge, to be knowledgeable about your body system. And then, above all, there is one thing I always tell people. I am a Christian, a total believer of the Word of God, the Bible, the good book. The good book made us to understand it. It says in the book of 3 John 1:2. I will read it so that you understand what I'm saying. That it is the will of God for us to be in good health. It says, above all, my people, beloved, I pray that every way you may succeed. Sorry, I take that again, please. 3 John 1:2, it says, beloved, I pray that every way you may succeed and prosper and be in good health physically, just as I know your soul prospers spiritually. I'm reading from Amplified Bible. So it is the will of God. He said, as you're prospering spiritually in your soul, it is the will of God for you to also prosper in your health physically. So this is the will of God for you and I to be in good health. Therefore, we should also take good care of ourselves. Each and every one, please take care of yourself. And as I always tell you, in my next video, we'll go on the second series of this, because it's going to be a series of kidney care, okay, and condition and all about kidneys. All right. So at this point, I'm going to ask you kindly subscribe to my channel, sorry. Subscribe to my channel, please. Give me a thumbs up. Comment, please, 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 please. Make a good comment and then share me out. Make this knowledge go viral, please, so that other people will also watch and get knowledge, because it is said that knowledge is power. I'll see you in my next video. Stay healthy and take care of yourself. Bye for now.